Good afternoon, and thank you for attending today's webinar entitled Best Practices in Healthcare Using Fax to Support HIPAA, Regulations, and Meaningful Use. We look forward to sharing our experience and best practices that we have learned by working with some of the world's leading healthcare organizations. I'd like to introduce myself. My name is Tom Bishop, and I'm the Executive Vice President of Sales, and I have over 25 years of healthcare experience.
Hi, good afternoon, Tom. And this is Antoinetta Carboni. I am the Manager of Partner and Channel Sales here at Biscom, and I've been with Biscom for 21 years and had a lot of focus in the healthcare space as well.
Excellent. Well, welcome, Ensenada. Before we get started, I'd like to go over the usual housekeeping items. Please use the Questions tab to submit any questions you may have throughout the presentation. We love answering questions, and we encourage you to ask them. We will do our best to get to each question at the conclusion of the presentation as time permits. If you encounter any technical difficulties, please use the chat feature to let us know. And finally, this session will be recorded, and the link to the recording will be sent out at the conclusion of the presentation. Now, on to today's agenda. Today, we're going to be discussing best practices using computer faxing to support meaningful use and HIPAA regulations. At the conclusion of the presentation, we will have touched upon the following items: why is fax needed in healthcare, HIPAA and meaningful use, some of our best practices, Biscom healthcare integrations, Biscom solutions, and of course we'll have some time for questions and answers. So let's start off with why is fax used today. Well, it's certainly a tried and true method of communication that's been around for many, many years. It's certainly secure, it cannot be hacked, and organizations all over the world use fax regularly, some sending out millions of pages a day. Fax is considered a legal document by courts, which can add another level of comfort based on the specific healthcare application, especially dealing with legal challenges, claims, and contracts. So why is fax used in healthcare today? Well, first off, operational efficiency. With integrated fax workflow and automated routing, Biscom solutions will help you optimize your processes to save both time and money. Security is also important. Biscom's secure document delivery products help providers maintain HIPAA certification and keep patient records secure. And certainly, and probably most importantly, patient satisfaction. Lost or misfiled documents are a major cause of delay that impacts patient satisfaction. But with Biscom, your documents will always be where you expect them to be. A lot of people ask me who uses fax in healthcare today. First, fax is everywhere within healthcare, including labs, doctors' offices, insurers, and hospitals. It's common to have multiple methods available, ranging from a traditional fax machine to a fax server or even cloud faxing services. Fax is easy for everyone to use with no training or explanation needed. Most users in healthcare are already familiar with how to send faxes. It's a very common and comfortable method of exchanging critical documents in business today, and especially within the healthcare community. Many healthcare organizations rely on fax as a vital method for delivering protected healthcare data. Fax is known as a trusted method of delivery, where it is expected to always work without fail and with the trust that it will be secure. Fax is a point-to-point transmission that doesn't traverse the internet, so it's shielded from prying eyes and is as safe as a phone call. In other words, fax is a private method of transmission that is trusted and secure, especially when integrated with production fax servers and cloud services. A discussion of fax in healthcare should always include a discussion on using fax with considerations for Health Insurance and Portability Accountability Act, otherwise known as HIPAA. HIPAA was designed to protect personal patient information. A core component of HIPAA is to log and audit what happens to patient information, the who, what, when, and where of the patient data. As part of this, it is required that you protect the exchange of patient data. And in fact, The U.S. Department of Health and Human Services accepts fax as a secure method of delivering patient data out to all outside entities. When it comes to fax and HIPAA, the first concern is protecting the transmission of patient data. In a traditional fax machine environment, organizations need to physically secure all fax machines that are used to transmit or receive faxes containing patient data. This would require having locked rooms where the machines are stored and assigning specific personnel to be in charge of sending and receiving. That can become difficult, costly, and certainly time-consuming. The next challenge when using fax machines is a requirement that the fax be physically placed or scanned into the patient's record. Additionally, after a fax is scanned, the patient copies need to be destroyed, which adds overhead and time away from patient care. Furthermore, the cover pages included with an outbound fax that contains patient data need to contain some sort of a disclaimer that the fax contains protected health information and needs to mention that it must be kept private. Lastly, in order to comply with meaningful use, when a fax containing patient data is sent or received, there needs to be a log kept of all transactions. When using fax machines, you need to keep the paper logs from the fax machine or transcribe them to a patient record. Both of these options are costly and time-consuming. These problems can be fixed when using a secure fax solution from a provider who is familiar with the challenges of HIPAA. So what's meaningful use in healthcare? Well, it's a government incentive for using electronic health records known as EHR or EMR. Meaningful use means providers need to show they're using certified EHR technology in ways that can be measured significantly in quality and in quantity. Ultimately, it involves the need to move the healthcare industry away from a paper-based system where a doctor's handwriting needs to be interpreted and patient files could be misplaced in the office. Documents would often be misplaced during an exchange of patient data and information between, for example, healthcare professionals, healthcare providers and insurers, healthcare providers and patients. Now let's talk about best practices in healthcare and what organizations should be implementing to achieve compliance, cost reduction, improve patient care and satisfaction, and meaningful use. Well, it's best practice to remove your fax machines, which eliminates the need for paper, missing faxes, busy signals, errors, and most importantly, the danger of leaving PHI in a public fax machine. You should always secure and protect PHI by the encryption of fax documents at rest and securing access to the fax image. Ensure that there is reporting on fax transactions to help you achieve meaningful use. Audit all user actions to ensure compliance and track what happens to patient data. It's important to automate the sending of faxes to improve operational efficiency by reducing the time to send, allowing for more to get done with the same amount of personnel. Incorporate workflow integration of your inbound faxing to deliver information to the right place at the right time, and you should secure the delivery of faxes, which will help to achieve HIPAA compliance by using encryption and application authentication. Let's discuss the fax applications in healthcare. First, claims and billing. You have the ability to quickly turn around invoices by fax. You can also exchange confidential patient information with insurers to quickly and accurately process approvals. Well, how about within the pharmacy? Prescriptions can be sent fast, easily, and accurately by fax directly from EMR systems. For example, instead of physically printing a prescription for a patient, a doctor can click print a fax and have the prescription transmitted through their fax server. Pharmacies use fax service to eliminate fax machines, which helps them to automate and manage faxes in order to fill prescriptions quicker and to protect patient information. With medical records, you can leverage the investment in your electronic medical record system by reducing the expense of managing a hard copy of the fax and storing it by removing the fax machines and using a rules-based routing engine to deliver incoming faxes to your EMR system. You can also automate the sending of patient information via fax by eliminating the need to print out a document and walking it to a fax machine. With patient data exchange, fax is a common method used for exchanging patient data between EMR applications and the outside world. Fax increases the accuracy and reduces the time to delivery. Without secure fax, clinicians would have to print out the patient information and then walk it to a fax machine to send the fax, which wastes valuable time. With production fax, the documents are sent directly from EMR applications, reducing the time to send by over 95%. Furthermore, users can be forced to use the native phone book within the EMR application, which increases the accuracy of the fax delivery, once again helping you with compliance. Lastly, fax delivery information and inbound faxes are available within the patient record, providing easy access to data and complying with meaningful use. Physicians' orders. You have the ability to electronically share documents with outside labs for testing, with providers for various procedures, with imaging centers for diagnostic evaluation, and for the collaboration with a specialist. All of the fax orders and requests are documented within the EMR system they were sent from. Transplant processing. This is one of the more vital applications of production fax in healthcare that we have seen in recent years. It's the processing of transplant requests. We have customers that are sending requests via fax to add patients to a transplant list. These requests are sent using the Biscom APIs to automate the process from the application to the transplant database. Conversely, the organ bank sends a notification of availability out to the eligible hospitals. The process is certainly time-sensitive, with the need to report and track to ensure patient care is the top priority. And how about central scheduling? Well, most of us have certainly experienced the pain and inconvenience of sitting in a waiting room, waiting for a procedure well after our appointment time. We assume the cause of the delay is the doctor or the clinician being tied up with another patient, but we have found that this is not always the case. In the past, a lot of orders were received on fax machines and stored in file cabinets, or if you can believe it, they were placed in piles of paper. It almost seems like stacks so high that when we went into the office, they reach over our heads. Well, as you can imagine, orders were very difficult to find when patients arrived. This required the orders to be refaxed, which delays patient care. With production fax and Biscom workflow, the faxed orders are received electronically and stored and indexed within a database. The order can be accessed by medical record number of patient or patient name for quick access when patients arrive. Wait times have been drastically reduced in these institutions, and more procedures are being completed. So let's talk about the benefits of Fax Healthcare. Well, certainly number one is enhanced productivity, and we've discussed that already. Number two, reduced cost. As an example, integrating fax with EMR enables your organization to send faxes from any application. So instead of physically printing a prescription for a patient, a doctor can click print to fax and have the prescription transmitted through their fax server. You can also receive faxes directly into the patient record. Number three is certainly increased scalability of a fax server or cloud fax solution that allows you to quickly and easily expand your capacity to send and receive faxes. And lastly, with increased security and compliance of using a fax server or cloud fax solution, you now have the transactional data on the status of a fax job stored within the patient record. Faxes are delivered directly to the recipient, which removes the possibility of prying eyes. So now I'd like to turn the presentation over to Ensenada, who again is our partner and channel manager. She will be discussing some of the customers she has worked with in the past.
Great. Thanks, Tom, and thank you, everyone, for joining. Now that we've talked about fax and healthcare, let's talk about who Biscom is and how we help our healthcare customers. You may or may not know that Biscom created the very first fax server in 1986. Over the last 30 years, we focused on being the best fax solution provider in the world, and you can bet no one else has more experience than we do. While the majority of our investment and focus is on fax, we believe innovation is also a critical factor in the success of our company, and we've evolved to include additional ways to deliver documents. We also offer secure file transfer solutions, cloud-based fax, and file transfer services, file translation, and IP-based document delivery. These are just some of our customers in healthcare. We have many others we have integrated with, but we wanted to show you some of the larger implementations Biscom has worked with over 30 years. Biscom has partnered with many healthcare vendors to help provide seamless faxing in healthcare. By partnering with these companies, we are able to do things like enable users to submit faxes directly from applications, automatically extract the sender and the recipient fax information, adding additional protection for patient information, faxing electronically to streamline the workflow process, track fax transactional information, including status in the patient record. On this slide, we just have a few of our partners. Over the years, Biscom has learned to partner with all the healthcare providers out there to better deliver solutions to our customers. Let's highlight one of our healthcare partners. I think everyone on the line is very familiar with Epic. Epic is one of the largest deployment of desktop of all EHR vendors. The combination of Epic with Biscom's fax solution has automated and simplified the process of sending patient data directly from the patient record. They have used the Biscom APIs to allow any document that can be printed to also be faxed out of the Biscom solution. In addition, the status is brought back into the medical record. The integration allows healthcare professionals to send faxes directly from 12 workflows within Epic, including EMR and Radiant systems. Inbound faxes can automatically route it to a folder on the customer's network as either a TIFF, PDF, or a searchable PDF image. An Epic-approved document management solution such as Hyland OnBase will scan the folder to import the fax into the document management solution and attach a link to the appropriate patient record within Epic. Let's talk about Hyland OnBase. Hyland OnBase is an on-ramp for applications like Epic and many others. You can fax outbound and inbound, and it has direct integration with the Biscom solution. GE Centricity is a longtime partner of Biscom, and it is the only partner of the GE healthcare system. It is the only vendor that has direct integration with GE Centricity. In fact, GE wrote the integration module. The integration allows healthcare workers to fax prescriptions, including refills to pharmacies, referrals, charts, documents, and letters to outside healthcare providers and patients. Clinicians are restricted to choosing fax number from the native Centricity phone books. Fax status is then returned to Centricity and can be inserted into the patient record. All of the Biscom integrations we've just talked about and many others are accomplished by using our Fastcom Suite solution to manage and control the faxing ecosystem. Fastcom Suite is really the intelligence of the solution. Integration with directory services, including Active Directory and other LDAP-compliant directory services, is done by the Faxcom queue. Group policy and Fastcom policies are used to control the user's faxing environment. There are numerous clients available for users and application, including web, desktop, mobile, and Outlook client. Mobile clients are available for Android and other devices such as iPhones and iPads. The web and desktop client have the ability to send and receive faxes with options for workflow capability and broadcast functionality. Our advanced fax routing module is a rules-based engine that is used to deliver inbound faxes to a variety of destinations while allowing for the automation of the workflow. It works by setting a condition and then taking an action. It can be as simple as routing based on a time of day or as complex as reading a barcode while doing an ODBC lookup. APIs are used to integrate faxing with other applications and processes. So with our delivery and our solutions being fax, SFT, or file sharing, through our APIs you are able to integrate all applications. Here are some of our advanced client features. We have found in the healthcare space, for example, scheduling likes to have different roles, and for compliancy purposes, we want those managers within those areas to be able to go in and look at their users and make sure they are following all procedures properly. With the Biscom Advanced Client features, you are given the ability to follow all compliancy within each organization. The search functionality has been enhanced and broadcast management has been made much easier. Users sending broadcasts can now see a status on the entire job instead of one at a time. This is crucial. So if when they send a broadcast, they would get a report of a total number that failed and succeeded while still providing access to the details. All failed jobs can also be resent as one. Job tracking and reporting is used for different purposes. It was originally developed to monitor faxes to make sure they reach the intended destination in a set amount of time and trigger an alarm if they don't. While many of you know, in the healthcare businesses, time is crucial. Healthcare providers are looking to get procedures in place, to get approval from insurers. So this is a module that helps users, helps administrators to be able to deliver those reports and make sure everything is being managed properly. At the same time, it gathers a lot of information about each fax, which allows for extensive reporting. The reporting web client provides numerous standard reports while giving you the ability to customize reports for your needs. You can also schedule reports to run on a regular basis to provide information to users while only having to set them up once. As an example, you could schedule a report to automatically be emailed to a manager every Monday at 9 a.m. to let them know where their departmental usage is at. The Fastcom helps customers monitor their faxing solution. It can be used to monitor items and alert if they go above or fall below a threshold. An example would be monitoring a fax server to make sure there are always faxes coming in, and alert if the amount of faxes fall below the expected value. You can also set monitoring times to avoid getting alerts during off-peak times like nights and weekends. There are 100 of data points that can be monitored on both the Fastcom server and suite. In addition, each administrator can have their own customized dashboard, allowing them to only monitor items that are relevant to them in their organization. Alarms can be displayed on the dashboard console or sent to an admin via email. And lastly, one of the things I would like to touch upon is really Biscom being a secure document delivery solution provider. We provide fax, we provide secure file transfer, and we also provide secure, free file sharing and syncing. To touch upon SFT a little bit more, I know we focused a lot on fax. SFT and fax and VeroSync all work hand in hand. All three products are tightly integrated. The great thing is it falls under one organization like Biscom, so all your support, all the knowledge base falls all under one engineering team and technical support team. So if you are looking for fax, Biscom is able to provide that feature set to the organization, to the application. If we're looking at sending large files, we also provide secure file transfer, and any syncing and sharing that organizations are looking for, we can also provide that to you, and we can do that to fall all under your compliance and meet HIPAA regulations as well. Now it's time for questions and answers, so please submit all questions that you may have. And I do want you to know if we're not able to answer all your questions in this time that's allotted, we will get back to you short after this webinar.
All right, Ensenada, thanks very much. And we do have some questions coming in. So let's see. The first question I have, Ensenada, for you is, can I use your system to read barcodes off a fax, specifically the patient record number embedded in the barcode?
Absolutely. That is done with our advanced fax routing product. So basically, depending on the needs of the organization or the business unit, we can use standard barcode, and we can deliver that fax to any endpoint destination that's needed.
Okay, excellent. How about this, another one I have coming in. Can I define roles for my users? I have nurses and doctors.
Yes, you can, and that's done through our advanced client feature set. So like I had touched upon earlier, in many of our organizations, healthcare specific, and let's take example scheduling, there's different roles that partake in that type of organization. So you'll have roles to schedule procedures. You'll also have a compliancy role at times, like a manager role. So you can definitely do that through our advanced client features. That's standard within our product.
Okay, excellent. All right, I have another one here, Ensenada. Is this a cloud-based solution or an on-prem solution or both?
Well, Biscom offers both. We offer on-premise, we offer cloud, and then we also offer hybrid, where you have a mixed environment. You'll have on-premise virtual servers, and virtual being an example, we also offer PRI T1 analog systems. And with hybrid, you can have on-premise servers and the cloud communicating to Fastcom Suite simultaneously. A lot of people use the hybrid solution for DR, business continuity, but we are the only provider out there that uses the same front-end interface, which is Fastcom Suite, to manage both the on-premise and the cloud. So from an application or a user standpoint, nothing changes, and that is really the power behind Fastcom Suite. We're delivering the same feature set for both solution offerings, cloud and on-premise.
Okay, great. All right, another question for you. We work a lot with MFPs, apparently, and this question did come in regarding whether we support faxing directly from MFPs.
Absolutely. What we found, and what I found specifically over the 21 years of working with enterprise accounts, basically most of our customers will do a straight SMTP connection utilizing our Fastcom Suite component. If they're looking for direct integrations, yes, we do. We have partnerships with most MFP providers out there and connectors.
Okay, great. All right, another question. Do you support inbound into Epic?
Yes, we do.
Okay.
Absolutely.
All right, great. The next question, can I split faxes that contain multiple lab results?
Yes, you can. You can do that a couple different ways. You can do it outbound. You can do it for inbound. That's all done through AFR.
Okay.
For the inbound, yes.
Excellent. And another question, let's see, do you have the ability to monitor the system in real time?
Yes, you do, and that comes with dashboard. It will monitor the complete Faxcom ecosystem, being the server level, being the queue level. It will send alerts. It will provide information on thresholds that an administrator can set. And that is something that does differentiate our product out there in the marketplace, specifically in healthcare, seeing that faxing, secure file transfer is crucial in delivering these documents and patient data information. Dashboard gives them a view on the total system at all times.
Okay, great. Well, we are up against 2:30, but let's why don't we take one more question? And let's see, the last question I have is, do you offer any kind of professional services to help us with workflow setup?
Absolutely. We have a whole team of engineers that have over 15 years of experience specifically in the healthcare space that will be brought on when working with their account managers to discuss applications and needs.
Okay, great. All right, let me see if we have time for one more question.
Yep, and what is that question, Tom?
Let's see, one last question came in. What differentiates Biscom over WriteFax?
Wow, well that's a very good one, and that can be an extensive response, but let me start from a few different angles. Biscom has been around for over 30 years. Our focus has been in the secure document delivery space. That is our focus 30 years ago. That's our focus today. We have an extensive roadmap. We have a lot of different technologies that are coming into play to really, take it a step further. Where you see WriteFax which is now OpenText, has been bought out by multiple different organizations, and fax is not their focus as it is for Biscom. Along with technical support, we've done a lot of migrations over from the RightFax system to Biscom, a lot being in the healthcare space. And what everyone tells the Biscom team is that our support is superior. One thing that our owners and our current management team focuses on is customer. We want to be able to deliver our solution and make it streamlined. And along with technical support, we really handhold our customers through the whole process, being pre-sales, being post-sales. Our most important, item every day when we come in here is to make sure our customers are happy and they're delivering faxes and secure file transfers to their clients, being patient. So, those are some of the differentiators. And when we want to talk about product, some of the things like advanced fax routing, our dashboard, which is our monitoring tool, are real product differentiators, and the way we've designed it. We have a very modular design, and some of the integrations that we have over the competition out there are tightly integrated.
Okay, fantastic. Well, thank you very much. Well, it is just past 2:30, so we are going to wrap things up. And first, I want to again, thank everyone for attending today. This final slide, as you see, does give you some information regarding how to contact us, or if you want to just take a look at our web, you'll see that at biscom.com, as well as you can certainly get in touch via phone or blog us or through Twitter or what have you. So please don't hesitate to give us a call. If there's anything we can do to answer a question, we'd love to do so. And Ensenada, thanks very much for jumping on with me today. Appreciate it.
Absolutely, Tom. Thank you, and thank you, everyone. We look forward to hearing from you. Let us know if there's any topics that you would like us to focus on the upcoming webinars. We'd love feedback.
Fantastic. Thank you. Have a great day, everyone.
Thanks. Bye-bye.